What's going on, guys? Welcome back to another video. It's been a hot second since I've been on YouTube or talking to a camera actually, so it's nice to be back. But I just want to welcome you guys to the first episode of the Good, the Bad, and the Ugly clinical rotation YouTube series that I'm going to be doing as I go on with clinical rotations. Hopefully you guys have all been doing well. It's currently February and I'll be going over my personal good, the bad, and ugly experiences that I had during each of my rotations. And in today's video, we're gonna be going over emergency medicine. Again, everything that I talk about in terms of my experiences are my own, and they are my own opinions and beliefs. So take everything with a grain of salt. Something that I might have resonated with or something that I might have not enjoyed might be something that you enjoy or something that you don't enjoy. So again, it's all my own personal experiences and just sharing with you guys what I went through and how everything went. What I really liked about the rotation that I had, or the hospital I was at, is that they had a trauma center, they had a fast track center, and they had the main emergency department. And so the trauma center, they would only take patients if they were brought in by ambulance, EMT, anything like that. That was a pretty cool experience because the hospital I was at was the only level 1 trauma center here in Southern Nevada. So that was really eye-opening to see all the different cases. It was quite a bit of motor vehicle accidents, especially, you know, when it was rainy outside. But in general, it was a lot of car accidents, motorcycle accidents, kind of more freak accidents, I would say. Things like that. So that was really interesting for me to be able to be in the trauma department to witness all those things. The fast track is exactly what it sounds like. You want to get patients in and out. In this hospital, they would consider these patients, I think, level 3 or 4. The lower the number, the higher the acuity. You know, people with coughs, people with small lacerations, abscesses, things like that, where the provider can come in and out and get them on their way. And so that helps with the sheer volume of patients in the waiting room, because the waiting room is always busy, especially at this hospital. The main ED is where, you know, you get patients with chest pain, anything like that, any more higher acuity, and they're usually there for, you know, a few hours depending on obviously their condition. The main ED, it was way more resident based, more heavily crowded with residents. Yeah, the main ED was kind of, you know, the in-between between trauma and fast track. I really loved that there was all these different departments in this hospital where I could be a PA student, being in trauma, being in the main emergency department, and also being in fast track with mostly PAs. Secondly, like I mentioned earlier, there are a lot of residents at this hospital as it's a teaching hospital and there's a residency program linked to the hospital. And so there was quite a bit of residents in the main emergency department. And something that I really am thankful for and really appreciated was how helpful they were in terms of teaching me and showing me the ropes. As a PA student, I didn't have any access to computers in terms of, you know, having a login or access to Epic or any of the patient records. So I was kind of like a fly when I was in the main ED with them, where I would have to kind of be very close with them and ask them all these questions, asking about the patients, asking them about their labs and, you know, the lab results, things like that. So I'm really thankful that, you know, most of the residents were very helpful and willing to teach, even though they were like my age, and some of them were even first year residents and second year residents who, you know, pretty much were similar in age with me, which is pretty cool. So another thing I loved about this rotation was that I only had 14 shifts. So I worked 10-hour shifts and I worked 14 days throughout the month of January. And it was nice because I had quite a bit of days off. So like half the month I wasn't working. Some of those days I was spent recovering from working, you know, overnights, things like that. But for the most part, it was broken down into 14 10-hour shifts throughout the month. And usually they were in like chunks of 3 to 4 days in a row. And I personally kind of liked having more days off as opposed to working 5 days a week. But again, you know, you guys know I am going into family medicine when I graduate, so that's most likely going to be a five day a week type of gig. Hopefully it's a 4 day a week type of position, but yeah, that's more, you know, the classic 8-hour days, things like that. And so going along with those 14 shifts, something unique about my rotation was that I had a different preceptor every single day, whether that be an attending physician or a PA working that day. You know, that definitely can be broken down into being part of the good, the bad, and the ugly. I'll mention kind of the good parts of having a different precept every day right now, in the sense that you get a unique perspective and you get to observe different providers, how they treat patients. So it was really cool to see different attendings, different PAs, and how they operated and what their thought process were with different conditions. And the main thing I absolutely loved about the emergency department as a whole was that it was very hands-on. Especially trauma and fast track, there weren't a lot of residents working in those departments. So it was usually either the attending physician, maybe one resident, and then me in trauma. So a lot of suturing, a lot of stapling, a lot of blocks, like digital dental blocks were done by me. And I'm really happy that I was able to be very hands-on in that situation. And in the fast track, it was mainly PAs working, and they were very receptive to teaching and, you know, having me do a lot of the hands-on things as well. So I got to do a lot of suturing, a lot of stapling, a lot of digital and dental blocks. I got to remove an ingrown toenail as well on my last day, so that was really cool. But I did really like how hands-on this rotation was for me. And going off being very hands-on, you know, I was a part of a few codes, a few successful code blues, and a few that weren't as successful where the patient actually passed away. So you know, first time doing compressions on real patients, and it's, you know, obviously different from doing it on a dummy, but you know, when you're in the moment, it's pretty high energy and you want to be doing very legit compressions. And so my second patient that I ran a code blue on or was doing compressions on, I did crack her ribs, and it kind of almost sounds like, you know, your knuckles cracking, but to a little bit more larger degree. All right guys, so that was the good portion of the emergency department and things that I really enjoyed or things that I really liked about my clinical rotation and my hospital that I was at. If you want to hear my experiences regarding the bad and the ugly in terms of my emergency medicine rotation, go ahead and hit that thumbs up. If we get 100 likes, I'll go ahead and post that video for you guys. I do want to keep these shorter, like I said. So I want to do this thing as well where at the end of the video, we go over one medical Spanish word. And I think the most important Spanish medical word you can know, if you were to know any, is dolor, which means pain. So dolor, pain. And so any Spanish patient comes into your clinic, you're not able to get a translator in time, go ahead and use dolor as, you know, obviously meaning pain. And I think the easiest way to do is just point to where they're obviously experiencing the pain and ask them if they have pain. So we are still selling the B positive and the blood type B positive shirts and hoodies, so go ahead and go to the link down below to my website, jameskimpa.com, and go ahead and cop yourself a t-shirt or hoodie. Don't forget to be like my blood type, B positive. I'll see you guys in the next one. Peace.